acute kidney injury, and liver failure. So I'm Ssematala Hawa. I'm first year SHO, and the case is, I have TA, date of birth is 2nd June 2015. He's 4 years and 6 months. He's male. Residence is Salama Road, Machinde. History is from the mother. He's been admitted for 10 days on ward. So the patient presented with fever, cough, and flu, generalized skin rash, yellow eyes, body swelling, and reduced urine output. Those are the events on how they occurred. So the patient was well until 13 days ago, prior to the admission, where he came in with fever that's high grade, constant, with generalized body weakness, not associated with any loss of consciousness or convulsion. The fever was relieved with paracetamol. Then later on, the child developed cough and flu, had difficulty in breathing, but there was no chest pain. Then 5 days after the event happened, he developed non-itching skin rash that started on the face, the trunk, then the extremity. However, was associated with oral sores. Then later, 3 days later, he develops generalized body swelling that started on the face to the limbs. It was associated with reduced urine output and yellowing of eyes. While on ward, the patient passed black stool that was associated with abdominal pain, vomiting, coffee brown vomiters. Initially, the child was managed in a clinic with IV fluid, unknown medication. There was no improvement. So the mother decided to treat the child with herbal drugs. When we looked at the review of other systems, nothing was remarkable. However, the past medical history, this was the second admission. The first admission when he was 2 years old with a febrile illness. On the immunization was not up to date. The child missed the immunization because the mother was too busy. So on prenatal, perinatal, and postnatal, the child was born by SVD, birth weight was 3, so nothing remarkable there. So the nutrition and the growth, everything was unremarkable. So family history, he's the firstborn of 3 children, other siblings are male. So the other siblings are all admitted on ward due to measles. And significantly on exam, he was sick looking with hyperemic conjunctivitis, healing maculopapillary rash, had moderate pallor, moderate jaundice. Then we had dry mucous membrane with the lips cracking, periorbital edema with periorbital swelling with edema grade 2. Then on CNS, he was lethargic. Then significantly on the abdominal exam, the patient had tender hepatomegaly with 4 centimeters below the costal margin. So in summary, we had a 4-year-old male with fever, cough, flu, and skin rash, body swelling with reduced urine output. Then there was passing of black stool, abdominal pain, vomiting, and yellowing of eyes. The child was not fully immunized. So on that note, we came up with the measles complicated with acute kidney injury, viral hepatitis, gastritis with upper GI bleeding, then with pneumonia. So if we look at our CBC on the 4th, there was leukocytosis of 36. Then remarkably, there was neutrophils, that was 54. Then still on the 7th, there was also still leukocytosis. And we can see the anemia was microcytic, hypochromic anemia, and the platelets were normal. Then if we look at the liver function and the renal function, the urea On the fourth, still you can see the urea keeps increasing. Creatinine is also increasing. So we can see the increase is about, okay, for creatinine is about 10, and the urea is about 5. Then markedly we see the sodium and the chloride was also low, but potassium seemed to have increased on the 8th, 5.8. Then when we look at albumin is also less, it's 21. However, there seemed to be some improvement as the days went by. Then if we look at the aspartate aminotransferase and aspartate alanine aminotransferase, we can see it's about 1,836. That's like 40 times the normal. However, we can see that the liver function is improving as the days go by, while the kidney function seems to be deteriorating in our case. Then we did a peripheral blood smear which showed normochromic, microcytic, and the number of platelets were normal. Hepatitis B was negative, HIV was negative. Urinalysis, however, showed protein plus, that's 100 milligrams per deciliter, and the red blood cells were plus, 3 of them, greater than 100 per high field. Then when we did the ANCA, the anti-nuclear antibodies, we see that they are negative. This complement C and complement 4 were all within normal, and anti-streptolysin was also within normal. Meaning we tried to rule out if the child had some systemic lupus erythrocytosis and post-streptococcal glomerulonephritis, which we can see from these results it was negative. However, the scan showed we had a focal polycystic and mild hepatomegaly and mild ascites. We also had moderate renal parenchymal diseases. On management on ward, we inserted NG tube, we gave tetracycline, vitamin A, we gave IV level, ranitidine and IV furosemide, and we also gave vitamin K. Then we also initiated, we gave erythropoietin. We gave Kayexalate, domperidone. We restricted the patient from having fruits and protein. We had a fluid balance chart, and we also did a daily weighing. So those are some of the results we can see in the urine output and the input and the BP. The BP, the blood pressure for this child was within normal to pre-hypertensive according to the weight and the height. Then currently on ward, the child has bleeding on the lips, vomiting several times, he's restless. On exam, he still looks sick looking. There is stingy of jaundice. However, he has significantly a hematoma with oozing blood. He also has grade 1 pitting edema. Now on abdomen, it is distended, tender. He has positive shifting dullness. And CVS, we see that he has early systolic murmur because of the anemia. And CNS, he seemed to be irritable. So finally, we've come up with a 4-year-old male with acute liver injury secondary to either herbal drugs, paracetamol, and viral infection. The second diagnosis is an acute kidney injury secondary to the viral infection. So our long-term management, we thought of, okay, we're supposed to have dialysis. We also discussed with the parent about the prognosis. Now, the prognosis, the kidney might resolve, or he might end up having a kidney failure at the end. So, kidney failure. So thank you.